Hi, everyone, and welcome. Hi, Jana. Thanks so much for joining me.
Hi, Anne. Thanks for invitation.
Yeah, amazing. So, guys, if you're joining us live today, it's so good to have you. Actually, let me just take these off so you can see my face, my eyes without the blue screen. Jana is joining us today to chat about exercises, therapeutic exercises, and what we can do with them. Because I think, especially in dogs, there is just so much scope to be creative. And Jana's really been showing her creativity in the last, I don't know, year or two or three, maybe longer than that.
5.
5. Wow. Okay. Amazing. So, guys, if you're joining us live, please join the conversation. We're here on social media so that you can chat with us, discuss with us. It's the whole point of why we're here. So please engage with us. This is your opportunity to ask Jana questions, to pick her mind, to pick her brain, to share any ideas that you have. Let's get creative together. I always love that. If you're live with us, let us know where you're watching from, where you're joining us from, and who you are so that we know who is with us. Here we have from the University of Oxford. It's so great to have you join us. Thank you. All right, Jana, will you please introduce yourself and your interest in therapeutic exercises?
Okay, so my name is Jana Gams, and I'm a veterinarian and a certified canine rehabilitation practitioner. I'm also the founder of Dogs for Motion Canine Rehabilitation and Sports Medicine Center. We are located in Slovenia, Central Europe, where I work with canine clients and their owners on a daily basis, including also participants of big international sports events. And I am myself also an active competitor in agility and FCI obedience with 18, 19 years of experience in dog sport training. And I'm also an owner of 3 border collies aged 12, 9, and 1 year. So the question about the interest in therapeutic exercises. Actually, my interest in therapeutic exercise began when my second border collie, Ginny, got injured at a very young age of 9 weeks. So what happened was I was carrying her downstairs and unfortunately we both fell. And so Ginny, my puppy, she ended up with a fracture of tibia. So she had to go through a surgery. And we also missed quite some important weeks of puppyhood. And I was still a vet student then with very little clue about rehab that even exists, and yet even how much one can make in the terms of improved physical well-being and also abilities of dogs. So the leg healed after surgery. We began training agility, we began training obedience. She was doing fine actually. And at one point, I got an opportunity to sign up for a preventative musculoskeletal checkup from a professional abroad. And this is when I learned that such things as muscle imbalance and loss of range of motion even exist. And I also learned that you can target these weaknesses and improve them with rehab and with therapeutic exercises. So you see, I love training with dogs and training them for sport performances, training them for fun tricks. Do you know that I even trained them to act in commercials and movies at a certain part of my past?
Really?
Yeah. Now imagine me learning. I can take on therapeutic exercises that look like fun tricks while also addressing my dog's physical weaknesses to, in fact, improve her performance abilities and help prevent further injuries or compensatory changes that could otherwise develop within her body. And I think this was my breaking point. And this is what I want to do in my life, and taking on further studies about rehab, about sports medicine, and practicing it. And coming up with all these possible therapeutic exercises the dog can enjoy participating in and benefiting them. And in the end, this is what motivates also the owner to continue practicing them to further gain benefits.
I love that. Thank you, Jana. I think that's so you really found like that thing that makes you tick. I think that's so exciting. That's amazing. Because yes, I mean we know, as rehab therapists, we know that therapeutic exercises are important, and especially in canines, generally I would say like it makes up half your session, Sometimes it makes up more than half a kind of normal session, if we can put a normal label on rehab. But so it does make up a big part of what we're doing. But I think that we often get kind of stuck in just doing the same things. And many of us, without a training background, you don't think of the different possibilities. So for you, where have you found therapeutic exercises to kind of be the most valuable? Like in which patient group or in which kind of area has it really stood out for you?
So, well, that is a broad question, actually. I think first I would like to highlight like 5 major advantages of both therapeutic and conditioning exercises. And by that, I mean therapeutic exercises for me are the ones we prescribe in rehab. So post-injury, post-surgery, in convalescence, so when animals are recovering from any illness that resulted in loss of physical condition, and we need to gradually regain it back to the dog's abilities. And also at certain chronic conditions such as osteoarthritic dogs, neurologic patients, and so on. Conditioning exercises are the ones we prescribe to healthy animals to further improve their physical condition, their performance abilities. All of these are needed for the dogs to withstand the loads better that happen during their daily life activities, sports, or work. So I kind of can say that I have like 5 benefits of exercising that I find to be of most value. So one is definitely improving the range of motion in joints and muscles, and that means how optimally a joint can flex or stretch. So when a joint has limited mobility, it cannot move through its full range of motion. And this can restrict the normal movement patterns, and it also leads to stiffness and tightness in the surrounding muscles, also tendons and ligaments. And limited range of motion can affect like overall movement efficiency and performance. And also by that, increasing the risk for injury, decreasing functionality, and also decreasing the quality of life. The second thing, I think this one, the most people most know about it, is improving strength of tissues and cardiovascular abilities. Of course, to withstand loads better. So either loads from the daily life or loads happening in the sports or work. And therefore, we can actually directly increase the dog's ability to participate in activities better. We shouldn't also forget about the improving neuromuscular connection. So this means we help train and improve body awareness, proprioception. So proprioception is the body's hidden sixth sense of knowing where it is in space. We can also improve reaction time, that improves balance. So if a misplaced step happens to the dog, they're more likely to react in time before a fall or a crash happens. Also, we shouldn't forget about the mental stimulation. So performing a variety of moves and tasks, it really brings a welcome opportunity to provide like also mental stimulation to dogs and helps prevent boredom, destructive behavior, also helps to reduce anxiety and stress, and also enhances learning capacity and boosts confidence. So I think this is a very important aspect also for puppies and for senior and compromised dogs. And I also see performing exercises, it improves the bond. So this human-dog relationship and also effective communication. So exercises are fun to do. And I had so many clients really benefiting from engaging in such training sessions because it really enhances the connection and understanding between dogs and their owners. So I think with this answer, I also think I covered that I believe exercises are an essential part of the dog throughout their entire lifetime. So basically from puppyhood to their senior years, and of course for all dogs in between, whether they are suffering from illness or they are healthy, active dogs that participate in activities. Because therapeutic and conditioning exercises can really directly improve the animal's overall physical and mental well-being. It's just how well we know to adapt the training program to meet a certain age or condition needs.
Okay, you've given so much information there, Jana. Thank you. I want to invite our listeners, please ask questions or share your thoughts or comments. We're here so that you can chat with us. So don't let us do all the talking, please. You guys also have something to add to the conversation. And welcome if you're joining us live. If you've come on since the last time I've welcomed everyone, it's so good to have you guys here. Okay, Jana, I'd love to actually focus a little bit more on some of the stuff that you've said, because first you said, like, let's separate therapeutic versus conditioning and think about them differently. And you see exactly me, therapist without a competitive or training background, I'm just like, exercise gets the label therapeutic. It's all the same thing, but yeah, I can completely see that there's a separation when you want to rehabilitate from injury or dysfunction, and then make that transition to return to performance or optimizing performance. So that's very exciting. Okay, so with the range of motion improvement, again, I would love to say, right, when we think about, improving range of motion is my goal, then I'm going to do passive range of motion, and I'm going to do stretches, and then I'm going to try and find some active range of motion exercises that are applicable to that area, right? So you would be looking a little bit more at this active range of motion component in creating these exercises. Do you think that, I think we have a study in the members portal that looks at active range of motion versus strengthening versus stretching for improving range of motion. And it found strengthening to be the more beneficial, if I remember correctly, because now I have to go and remember what that said. So is that what you're kind of finding? Are you getting better range of motion improvements when you're trying to achieve this goal through active movement, through exercise?
So it depends on the case, actually, I would say. If you have like major adhesions going on in the joints or stiffened joint capsule, I think joint mobilizations are really an indispensable part of the rehabilitation. If you have like muscle contractions or something like that, then for sure stretching is something that can make a difference, and maybe just the active exercises wouldn't be enough because maybe the tissue isn't ready for that, or maybe the animal isn't ready for that at all. But once we can achieve like a good range of motion, or maybe the animal is able to achieve a good active range of motion through the exercises, then I would say this is definitely a place where active exercises come in, because they directly target the ability of the dog's neuromuscular component, and of course also this strength component, to provide benefit in a way that the animal can actually use this later on. So not just be able to achieve it, but actually to learn to use it in a way, because they actively fire their muscle fibers, they actively move their limbs through a wider range of motion. And I think this is what brings the difference. But like I said in the beginning, I think each of them has a special place in the rehab and in the, of course, also the conditioning part. So that's my view on it.
Awesome. We have a question from one of our listeners. How did your puppy Tide take to equipment growing up? Any hesitation? So I'm going to assume that those are that's exercise equipment, because we're talking about exercise. So yeah, any hesitations? Any thoughts on that?
Actually, no. And why is that? Because I really believe in setting the dog up for success. So regardless of what you train, what you do, which exercise you take, basically anything you take your puppy or any dog actually through any experience, I always try to find a way that it makes it easy for the dog, like in a positive reward-based approach. And it's the same with exercises. So I never expect from a dog that knows nothing or very little, to call it like this, and expect them to perform something on equipment or perform a move or something like that. So for me, they're like a blank paper, and I just like to think about how to start with little behaviors that I teach them. And through that, actually, yeah, I started when I got him. He was 8 weeks. So more or less what I needed is that he knows how to take reward from me. And that's basically it. So we introduced him to surfaces, to some foundation behaviors, foundation moves. And as he grew up, I was able to do more and more with him. So that's my approach, not just with puppies, but basically with any, untrained or, beginner dog, let's say.
Okay, thank you. I think that kind of covers your approach to the beginner dogs. And can you expand a little bit more on the equipment that you're using, and what equipment you find to be like really valuable to you Yeah.
So regarding equipment, I always try to find, let's say, environment that, I will repeat myself, that sets the dog up for success. So if the dog is maybe unwilling or hesitates to put a paw on something like a balance pad, I might even find just like a thin plank and just walk the dog over. They see that a new surface isn't something that is bad. And through that, when I see the dog is confident on one thing, I progress. I introduce new equipments. I present new platforms. And basically for me, one of these like really basic, the most foundational behaviors the dog, let's say, learns in the beginning is just to step on a platform, as simple as that. And this is really something so foundational that you can take on in any other piece of equipment you can think of or would like to use. And when I got a question about the equipment that I really like, it depends on the exercise, really. I of course have like my favorite pieces of equipment that are like low, nice and stable, and they can be very predictable, but also inflatables and unstable equipment has their role in the, let's say, aspect. So it depends.
It depends. I love that. Meg, welcome from chilly Cape Town. It's good to have you. Okay, I love that. Thank you so much. If you guys want to ask any questions, please feel free to do that. We're just going to keep kind of chatting. The third point that you mentioned is the neuromuscular connection. And I love that because that's definitely like that's something that we're thinking more and more about in horses. That's kind of my area. So it's amazing to see that you're bringing that into dogs. And of course, we always had that in dogs because we are rehabilitating neuro conditions. But there's more than just that neurological, there's a neurological lesion that we're rehabilitating, right? When we're thinking about that neuromuscular connection, when we're thinking about proprioception. So how do you kind of target that goal with therapeutic exercises? What are some of your things that you will focus on when you're trying to build that connection and that body awareness?
Yeah, I love to use targets. Like we mentioned equipment, but basically my equipment stands as target. So I like to introduce dogs to a variety of positions that they learn. So front feet up, rear feet up, side legs up, maybe stepping over bars, inclines, declines, and also all the moves actually within this that the dog can perform. And basically anything that targets the dog to perform something on their own, it improves proprioception abilities. It gives them this sense of their body, and that really directly, I think, improves, like I said, the balance component and just this reaction time. And we can have like both the improved performance, which everybody wants and likes, and also reduced risk of injury because they will be more able to recognize where their feet are. So just like imagine, I don't know, a young puppy or a growing dog with legs all over the place, and even when they just like run, they stumble and they make like all sorts of different things. But if this continues to the adult life, and the dog keeps being so clumsy, of course, many things can happen that we don't like.
And that's often the case, right, with like very high drive energetic dogs, is that they maintain that lack of awareness of their body and they continue to be clumsy. I've always found that very interesting because you're the ones that move the most, but they do it fast. I see the question. I'd love to just expand on this point because I think that I'd love to ask you about the training techniques that you use, because I think that directly connects with that that neural awareness, right? Because when we use things like positive reinforcement, then we're increasing the cortical mapping and we're increasing the motivation of the dog to have an even greater effect on how they're moving their body and their awareness of their body. And before you comment on that, I'm sorry now, I'm saying too much, but Amy Hesbach did a load of webinars for us on neurodynamics. And this was one of the things that she spoke about, is when we can increase motivation and we can increase that self-learning component, then we're going to have that kind of neural feedback and we're going to be able to improve the cortical mapping, etc. So the training techniques that you use, Jana, is this one of the reasons why you choose them? Why do you choose the techniques that you do choose, and what are you using?
So again, I would repeat that I'm a great advocate of positive reward-based training approach. So I like to teach dogs exercises from scratch by using treats to reward them for foundational behaviors that we then evolve and shape as the dog progresses, both in understanding and of course strength. And I believe that only an animal that is confident and motivated and happy to perform a certain position or move will truly gain from all its benefits. So I don't like to force the animal into position. I think it really breaks the connection and spirit of the animal. And on that point, I often get questions like, well, what if the animal doesn't want to take food as a reward? And I say, well, at least we have some praise and encouragement possibilities under our nose. And if nothing else, I'm sure we can get the dog at least to follow the owner through some slalom, for example, over quality rails, or even over some steps. And many, many times I see it happens, the dog starts to enjoy it to the level they even start taking food rewards. So this is what I believe, and yeah, this is what training methods I use. So I like to have dogs that are confident and motivated.
I love that. Okay, our question is, why do you think canine rehab or conditioning has a lack of research, and we have to loosely translate from human research and then apply it to the canines? That is such an interesting question. Thank you.
It's an interesting question. Actually, I have been asking myself this for a while, and how I see it is actually, it's very easy to tell a human, look, we will do research, we need so many participants, you're going to do this and this and this, and you have to do it in this and this condition. Well, in dogs and in animals, we have a lot of varieties going on. And we can't just say to a dog, well, you need to perform like 10, let's say, sit to stands, all the same position, all in the same, let's say, load. You have to tell me when you're fatigued and la, 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 la. And I think it's very loose because we can't replicate it as much as in the human field to actually pull out a resourceful, or how to say it, something that you can really say it applies to everyone. And I also see it in my work, because I can have like 15 dogs and 15 dogs will be able to perform the exercise in a slightly different way. But is this for the research a good thing or a bad thing? And at the moment, also what I see from a research perspective, what is available are mostly the moves that are easy to replicate. So it's either some running or some really foundational moves and, cardiovascular health, but anything that is more complicated, more dynamic, or maybe even is using more invasive measuring techniques, it's a bit more challenging to get there. And I think we still need to think about how to adapt the environment and how to teach the dogs in front of that. But then if we teach them in front of that, is it something that is, again, going to be extrapolated or no? So I think from one question, I can get like 20 more questions and we can get this discussion going on.
I think that's so valid, Jana, because it is difficult to find that kind of control. It's not the same. So the challenges that we face in our canine population is different to the human population. But I wouldn't say that there is no research in this area,
Exactly.
right? Like there's actually quite a whack of research with sled dogging, right?
Yes.
Where they're looking at all kinds of things from injury to all the other things around athletes, right?
Physical abilities,
all the other things, right? So there's quite a bit in sledding dogs, but then you're again, okay, well, that's relevant to the sledding population. Is it also only relevant to those breeds? Does it extrapolate to the others?
Yes, and we shouldn't forget, if I can just like cut through your word, we shouldn't also forget that in dogs we have major differences among the breeds. And actually, it was found out that, for example, a greyhound has a very higher percentage of fast-twitching fibers in their just genetics. And of course, you can train muscles to withstand more endurance or more explosive stuff, but some breeds have predisposition more for this. And for example, sled dogs and terriers and stuff like that, they have more of the endurance component. And again, we can't just take like a random group of dogs, because we have so many differences in the genetics already. So actually, it was like research-wise, I think we have to be very specific, because again, a research done on greyhounds might not apply to the Alaskan Malamutes or terriers.
Yeah, that is the challenge. And there's research coming out in the agility arena as well, because there's, I think, very enthusiastic owners in that area, like owners who want to participate and who want to know more and who like learning, and that's a big benefit. But well, I mean, it'll get better. It'll get better. There are loads of people like Arielle Pichette-Markey who's doing research all the time. I don't know how she does it. She's not the only one. So we will slowly fill in the gap, and I think that's one of the most exciting things about our field to me.
Yeah, and I would also like to mention here. I would also like to mention here my colleagues from Vienna University, and Barbara Buchstaller. She's also amazing in all this research.
Okay,
so, great.
I'm listening for that. Thank you. Okay, another question. What is the most beneficial foundation behavior to teach for rehab and for conditioning?
For me, targeting skills, I would say just like understanding the dog learns how to place their front feet on something and hind feet on something, and you can do everything out of that later on.
Can you talk us through that a little bit more? Like for someone who's never done targeting, how do you separate targeting with your nose to targeting with a front foot to targeting with the left front foot to targeting with the right hind foot? You know, how do you kind of separate? How do they know what you're targeting? Like which body part, please?
I actually love to do it through equipment setups. That I said so clearly, the dog really understands it from beginning. And if it's my desire to really teach them to perform certain moves independently, I can definitely take it on and just progress and shape the dog through the sessions that are coming. But if I want to just stay in the area where I need the dog to work on a specific exercise, because at this stage we have to, let's say, address it, I can also do it without the dog that really learns how to lift their hind paw on cue, for example. And if the dog knows how to come just like towards you and step on a low platform, this is already an excellent thing that you can use. And just inviting the dog forward and stop them when they keep their hind feet on and the front feet already in front on the floor, this is the next thing. And then I can just like combine the two and have the dog to come and stand on two pieces of equipment, so with front and with the rear feet on something. And from that, I can get like different moves, like stepping down maybe. And then just, teaching isn't just like, yeah, we got this and we will teach it. It's a journey. And we can teach it really from a scratch to a highly, highly complicated move or behavior. It's just a matter of how much effort we put into it and what are outcomes we desire, that I would say. So yes, I think targeting skills that become really independent, they take time. And if you don't have this time, you just use environmental setups and food, and you can just like help the dog to reach certain position as you guide them with food.
Okay. So what does that mean, independent? Like a targeting move that becomes independent?
Yeah,
what does that
independent mean? I would say that I say a cue and the dog performs it. Okay. So I don't need them to guide them to reach certain positions, but they kind of recognize it. But for that, it really takes time. It takes repetitions, and it's really a training component more than the, let's say, rehab or therapeutic exercise component.
Yeah. Okay. Cool. Another question. This is also a really great one. Thank you. Any tips or advice for new businesses in the field? What a good question. we're
Yeah.
gonna have a discussion on the subject. We actually have that live scheduled. So, Jana, if you would like to be taken off the hook and stick to the
Yeah,
topic.
actually, my biggest tip here, or my biggest advice would be know your services. Just like know what you offer, and learn this into infinity, and know all these possible indications where you can use either your techniques or modalities or whatever you have, the knowledge maybe, and just use this to your full potential. So don't try to be, like I would say, just, yeah, without a vision and without this creativity. Just take whatever you have, and you don't have to have everything, but you can do a lot with what you have if you learn about what you have. So that would be my advice.
I love that. Thank you. So I think that makes me think, knowledge breeds confidence. And it makes me think of that because it's one of the things that we really stand on, is that we want vet rehabbers to be gaining confidence by adding to their knowledge all the time. So that's kind of what the online pet health platform is built on, and what we hope to achieve. So I really like
and
that.
it's a
Thank
great
you, Jana.
platform. It's really a great platform.
Thank you. Thank you.
I think I have been member of your online pet health platform since the very beginning, I would say.
Wow, that's
of
amazing.
of my business
Of your
path.
business. Yeah, that's amazing. And I think it's so valuable, like if you're starting out in rehab, to be part of the online pet health community, because everything from business advice and business skills, which is what we are mostly lacking and have no idea about, to the clinical stuff, which is what we all care about. We have everything. We have it all, plus the community. And sometimes that community is the most important part, that you just have people around you who have been there, who know what it's like to be new and unsure. And geez, I still remember the first neuro patient that I had. I did my evaluation and I was so nervous. I did my evaluation and then I was like, please excuse me for 1 minute. Ran back to my superior therapist and I was like, what should I do?
Yeah,
and she just told me all the things I already knew, and I was like, oh, right, okay, I can do this.
Yeah, I think this confidence really is what we need in the beginning. That so to just like check on things, even if you do it already, just to have like a proof I'm on the right way.
Yes, and that's the other area. So like the first time, or when something is still new, you're continually checking yourself. But then when you've seen your like 100th cruciate case and you're just stuck in one pattern, doing the same thing over and over, then you also need to check yourself and say, hey,
exactly.
What am I missing here? Because it's not the same thing. Yeah. Okay. I love that. Thank you. I'm going to actually share some resources with you on starting out, because we have some free stuff that I'm going to send in the chat to our Facebook user who asked this question. And hopefully that will help you out. Do you want to let me know if you're mobile or if you have a practice? And then I can send you more specific things that can help you in that area. Okay, so I think I would love to, like, we've chatted quite a bit about training, right? And from my perspective in horses, I think that is one of the big things we're missing, is that as rehab therapists, we have really limited understanding and skill in terms of shaping behavior. And so when we want to achieve an exercise and we don't know how to shape it, and we don't know how to ask for it, and we don't know how to essentially train it, because that's what it is, we can get a little bit stuck. And luring can be valuable, but luring is also limited in how valuable it can be, especially when we need to take things a little bit further or we need to get creative. So how important do you think it is that we have decent, not necessarily good, but at least decent training skills as rehab therapists?
Yeah, well, for me, I have been involved in dog training, I said, like for already 19 years since I got my first dog that I started to train with some obedience and tricks with. And I think this training knowledge and skill I developed through years really is what brings me the confidence to really know how to motivate dogs, how to set them up for success so they can benefit from the training session without making errors, how to even achieve them perform a certain move right away with the help of, let's say, deliberate reward placement or targets that I mentioned, and to also have an eye for details and for the dog's emotional level during training session. But also, on the other hand, sometimes this is what backfires me a bit. I think because all dogs seem to work so nicely with me and I can achieve moves I desire really quickly, almost like right away. And when someone just watches, it seems so easy. And on the other hand, like, oh, how am I going to do it? So, of course, then this is the more challenging part. Also with the clients that I work with, and for example, with the owners, I also need to educate the owner and teach them, and they need to learn how to perform the exercises properly if I would like to prescribe them to perform as a part of their homework plan. But I also enjoy teaching, so it's just that, yeah, in conclusion, I think I find training knowledge and skill to be really, really beneficial here. And if we lack it, I think my biggest recommendation would be to just like get more involved in the training field and attend some webinars, attend some courses on that part. Even if you don't maybe own a dog, at least seeing how training process looks like, how dogs learn. And I think you can learn a lot by just getting more involved into this and just picking up little stuff, trying them with your patient, trying them with your dogs. And I think you will build in this part. So just don't stop trying and don't finish like, oh, I can't do it, I don't have this knowledge,
Yeah. No, I love that. And I actually love that you mentioned that there's like this gap between training is kind of second nature to you because you've basically been doing it all your life. So then you stop thinking about how it's done because it just comes naturally. And that's always really hard. That can be really hard to teach then because you don't realize what you're doing to achieve the positive result. So it's really amazing when you're combining that with teaching other people how, because it keeps you aware of how you're actually doing it. So I love that, Jana. Well done. We have, I love this person. I'm gonna, when we get off of this and I'm able to see your name, I'm gonna give you a big shout out. What's your favorite go-to Iliosoa's recovery therapeutic exercise? Where do you start with Iliosoas?
So whenever developing a therapeutic exercise program, for me, it is essential that we have a deep understanding of the dog's anatomy and movement. And if we are talking about the therapeutic exercises, that means we need to know about stages of healing, because we can provide isometric, concentric, as well as eccentric type of muscle activation. And in some stages of healing, we should avoid certain moves that would place, for example, too much stress for the healing phase the tissues are in. So if I have a question of what is my favorite go-to Iliosoas recovery, my first question is, what stage of healing the dog is in? Because I'm going to have a very different answer depending the injury happened last week, or if the injury happened last month, or if the injury happened last year and the dog is still not well. So, and yeah, the iliopsoas muscle is a muscle that is really involved in a variety of movement. It stabilizes the spine. It's also moving the hip joint, and basically all movement depends on the iliopsoas. And if this one is injured, we also have to think about it. And we need to know also what are our goals. So what action the dog will need to perform within their activity or sports performances that you want to return the dog to. And I would say that also the true importance lies in how well we understand kinetics. And we can then mimic and replicate the moves that are happening within their activity, and also how them prepare. So everything really lies in being specific, I would say. So yeah, I don't
I'd
have
love
like
to
a simple
reshape that question. I want to reshape that question for you, because my last question is, how do you think creatively about developing exercises that a specific patient might need? So if you want to walk us through that like creative process, with the example of an iliopsoas injury, I think that would be really amazing.
So first of all, like on your question about the creativity, I think you already saw I am a creative person.
Yeah.
I also like to draw. I like to create stuff, and I like to train with my own dogs. So I think all this experience I gained through years and different disciplines and sports that I participated in with my own dogs, it really helps me have a really wide pool of creativity when it comes to developing exercises a specific patient or a specific dog needs. So I always go to the functional part. So what are the moves the dog will need to perform? What is the muscle that does? So what activation? And I like to think in 3D, so the three-dimensional in all directions. So if you take a look, for example, at the iliopsoas muscle, so what does it do? What does it do? So it provides stability to the spine. So either flexing and extending. Then we have it's also the rotator of the hip. And that means I will try to recreate the moves that are targeting this. So for example, if I want to start really easy, just a simple, so it's also one of the core muscles, just a simple standstill, for example, or just like little cookie shapes where you're just rewarding in different direction. All the dog has to do in the beginning stages is just to maintain their stability in a stand. This is already going to target also the iliopsoas muscle because the dog will need to like isometrically contract them in order not to lose the balance, make a step or something like that. So yeah, this would be my first stage. And then I would like to progress and see, okay, I would like to have some nice concentric move happening. And that happens when the dog is like bringing up. I try to bring my knee up and I hit the table. So when the dog will be bringing their hip inflection, or they will just like move their knee upwards. So maybe some sit to stands, for example, or just like cavaletti walking that will like increase a little bit of hip flexion part. And of course, then progress later on to the eccentric part where the muscle will need to provide power as it elongates. And that would be more powerful movements like sitting and standing up to raise surface, or maybe even some, or later on, some plyometrics and jumping exercises. So yeah, I think when it comes to creativity, I like to think, like I said, always the stages of healing, and then what kind of muscle activation I desire. So is it isometric, is it concentric, is it eccentric, for instance? And of course, the moves that I would like to, recondition the dog for. And regardless of any muscle, I always think about these things that I mentioned. So.
Okay, awesome. Thank you, Jana. That's amazing. So Daniel Allen Ross, thank you so much for your amazing questions and for joining the conversation. It was so great to have you. Jana, I would love to ask you just one more thing. Who is the supplier of your equipment? So who does most of your therapeutic exercise equipment come from?
I have a variety of it.
Oh, you do? Okay.
Yeah, I do. And that is because I find value in different, let's say, equipment. And I love to use like do-it-yourself platforms, and I like to use equipment that is made. But if I have to point out some of the brands out there, for sure, I would say at the moment, I'm using stable platforms that are made from Flora Agility equipment that comes from Europe, from Poland actually. And I love also inflatables that comes from the Flexiness, and I love inflatables that comes from the Pitbull Sport. So I think these are the brands that contribute the majority of what I have. But yeah, I'm not a single brand. I just use whatever I find suitable, and that it's safe to use, and that it's unslippery, and that dogs don't have difficulties performing things while navigating equipment.
Awesome. Thank you for answering that question. I wanted to take the opportunity to give a shout out to one of our sponsors, FitPaws, because I know that you have quite a few of their equipment. So FitPaws does some amazing work. And they're one of our sponsors. They sponsor quite a few of our webinars. They're sponsoring our podcast, the Veterinary Rehabilitation Podcast. So if you guys have not subscribed to that, please do, because it's fantastic. And they're also one of the Vet Rehab Summit sponsors. And that leads me to my last plug for the day. I want to remind all of you that the Vet Rehab Summit is coming up, and I'm going to just share with you that, here we go. So on the 10th and the 11th of November is the Vet Rehab Summit, and we're going to be talking myofascial chains with Wiebke Albrandt. Why is this not coming onto the screen so you can see it?
I'm so looking forward to it, really.
Amazing. I honestly can't wait. I honestly can't wait.
Yeah, I already have it booked in my calendar,
That's the way to do it, Jana. Please, guys, book it in your calendar. This is a live event, okay? No recordings, live. You have to be there. And we have Wiebke and Rika live with us. It's an incredible opportunity to pick their brain. We have a bunch of Q&A sessions scheduled in so that we'll be able to just engage with them throughout both days. And it's canine and equine. And I think we definitely don't speak about the canine myofascial chains enough. It's time we got on board, guys, doggy guys, because it's really important. So please add that to your calendars, add that to your diaries. If you're a member of Online Pet Health, you get to come to the Vet Rehab Summit for free as a VIP attendee. Only our members get that access. So if you're not a member, ticket sales will be opening probably next month, and we're going to run a pretty epic super early bird special, so keep your eyes open for that. We're really excited about it. So Jana, thank you so much for joining me, and I look forward to chatting to you again, where we're going to be kind of going into more of the business side of things in a few weeks' time.
It was a pleasure.
Awesome. Bye, guys.
Bye-bye.